Knowing your HIV status gives you powerful information to help you take steps to keep you and your partner healthy. But the only way to know for sure whether you have HIV is to get tested. In Fairfax County, you can get an HIV test at any of the health department clinic sites, 5 days a week. Testing is free and confidential.
Hi,
Hello, welcome to Fairfax County Health Department. How may I help you?
I'm here to take an HIV test.
Okay. If you wouldn't mind just filling out the highlighted areas for me. Once you're done, we'll be right with you shortly.
Thank you.
You're welcome.
You may be asked some questions of a personal nature to help the nurse assess your risk for HIV, but your answers will not affect the test. Many testing sites also offer testing for other sexually transmitted diseases, or STDs.
Number 11. Hello, how are you?
Fine.
Oh, great. What can we do for you today?
I'm here to take an HIV test.
Oh, wonderful. Have you ever taken it before?
No, I'm not.
Okay, be advised, we also offer testing for sexually transmitted diseases. There seems to be a correlation between STDs and HIV infection. Very often, STDs can be a tag-along infection to HIV. Would you be interested in being tested for those as well today?
No.
Okay, no problem at all. I do need to ask you a few personal questions, and the reason for that is it would help me determine what your possible risk is to being exposed to HIV.
Okay.
In the last 12 months, have you been intoxicated or used drugs during sex?
No.
Okay. Have you had sex with anyone who exchanges money or drugs for sex?
No, I haven't.
Okay. Have you been treated for any sexually transmitted diseases?
No.
Okay. Have you had more than one sexual partner?
Yes.
Okay, very good. That tells me exactly what I need to know.
Doing the personal risk assessment allows the counselor and client to put together a personal plan for HIV risk reduction. There are actually 3 major types of HIV diagnostic tests, but the most common is the antibody test performed on blood. Antibodies are produced by your immune system when a virus, like HIV, enters your body. But keep in mind that it can take 3 to 12 weeks for a person's body to make enough antibodies for an antibody test to detect HIV infection. Some places offer a rapid test where you can get results in 20 minutes. In the health department, we use a conventional blood draw, and the results are available in 1 to 2 weeks.
You have your test results back, and they are negative.
That's great.
And I'd like to explain to you what a negative test result means.
Okay.
If the test is negative, it's important to take into account the window period. The window period is the time between when someone is infected with HIV, but before the test shows positive. Because of the window period, it is possible to have a negative test, but still have HIV. Generally, the window period for the test done at the health department is 15 to 20 days, but it could be longer for other types of tests. Ask your provider about the window period for the test you are taking. With a negative test, you may need to return for another test to cover the window period. Practicing the ABCs of prevention are important steps to protect yourself and prevent the spread of HIV. Abstinence is the most effective and only certain way to prevent exposure to HIV and other STDs. Being in a monogamous relationship or reducing the number of sexual partners also reduces the likelihood of being exposed to HIV. And condoms are 98% effective when used properly.
Well, now that you've received a negative test result and we have a plan for safe sex and risk reduction, do you have any other questions of me?
No. Thanks for helping me. And I definitely will commit to the prevention techniques that you share with me. Thanks.
For positive results, we offer the information you need to move forward with counseling and treatment.
The test results are back and the test is positive.
What am I going to do?
I understand this matter is very difficult to digest. You're probably feeling some anger, possibly sadness, maybe even fear. But one thing to remember, these days, HIV is not a death sentence. There's certain steps that can be taken.
After a positive result, it is important to see a healthcare provider. The earlier the treatment, the better the chances of preventing HIV from progressing into AIDS. With proper treatment, you can keep yourself healthy and greatly reduce the chance of transmitting HIV to others.
Please know that we are here to assist you into getting into care and offering full support until you can get into care.
Thank you. I really appreciate it.
Oh, my pleasure. We're here for you.
Every 9.5 minutes, someone in the United States is infected with HIV. The only way to know your HIV status is to take the test. Text your zip code to 566-948, know it, to find test sites near you. Let's make Northern Virginia a place where new HIV infections are rare. Get tested today.